Most people believe cancer always causes symptoms, but the truth is, colorectal cancer often develops silently for years. Many patients feel completely healthy while the disease is slowly progressing. The good news is that screening can detect colorectal cancer early, sometimes even before it develops. In this video, we explain how colorectal cancer develops, why screening is important, symptoms that should not be ignored, prevention strategies. This video supports awareness during Mars Blue, the campaign dedicated to colorectal cancer awareness and prevention. Hello and welcome. Today we are going to talk about colorectal cancer prevention and screening. Colorectal cancer affects the colon or the rectum, which are parts of the digestive system. Across Europe, it is one of the most frequently diagnosed cancers in both men and women. But there is an important message. Colorectal cancer often develops slowly, and when it is detected early, treatment outcomes are usually much better. That is exactly why screening plays such a crucial role in prevention and early detection. Most colorectal cancers develop gradually over time. In many cases, they begin as small growths inside the colon called polyps. These polyps are usually benign at first. However, some of them can slowly transform into cancer over several years. This slow progression is actually an opportunity. It means that screening can detect polyps before they become cancer, and in many cases, these polyps can be removed during a colonoscopy. In other words, screening can not only detect cancer early, it can sometimes prevent it from developing at all. One of the main challenges with colorectal cancer is that early stages often cause no symptoms at all. Many people feel completely healthy while the disease is silently developing. Unfortunately, symptoms may only appear when the disease is more advanced. Screening helps detect abnormalities before symptoms appear, which can significantly improve treatment outcomes and survival rates. In many countries, screening programs are recommended starting at the age of 50. People with certain risk factors, such as a family history of colorectal cancer, may require earlier or more frequent screening. For many people, the first step in colorectal cancer screening is a stool test. One commonly used test is the fecal immunochemical test, often called the FIT test. This test detects tiny amounts of blood in the stool that are not visible to the naked eye. It is simple, non-invasive, and can usually be done at home. If the test result is negative, screening is typically repeated every 2 years. If the test is positive, it does not mean cancer. But it does mean one thing. This is where the most important step begins. This is where many people panic, and also where lives can actually be saved. Because what happens next can prevent cancer before it even starts. Let me explain.